We'll begin the webinar. So a very warm welcome to everyone to this webinar hosted by IMT Care. So let's welcome Dr. Ankita with more than 15 years of experience. She has handled over 1,000 clients. So without further ado, let's welcome her. Over to you, Dr. Ankita.
Hello guys, I'm Dr. Ankita Gosar. I'm a physical therapist and my forte and my niche is pregnancy and post-pregnancy fitness. I'm also a certified childbirth educator, and over the span of 15 years, I've treated more than 200 women on their journey through fitness and pregnancy fitness and postpartum. And so today, I'm going to be talking about something known as PCOS. Am I audible?
Yeah, you're audible.
Okay. So, thriving with PCOS. So PCOS is the most common condition that is faced by almost 10% of women in their reproductive age, that is between the age of 10 to 45 years. And as a pregnancy fitness specialist or a pregnancy coach, I've had patients who have come and inquired if the biggest fear is that with PCOS, they'll be able to conceive or no. So without further ado, I'll talk something about PCOS, that is polycystic ovarian disease. So it affects women. And now what is this? Polycystic ovarian disease. It is nothing but a cyst formation in your ovaries. Now, ovaries are a very important part of your reproductive organs. They release egg. The egg from the ovary is released, which helps in when the egg and the sperm, they kind of connect, so that helps the women to conceive. But in PCOD, these ovaries, they form cysts. So there are, as you can see in this picture over here, so you can see the ovaries. There are two ovaries. One is a very normal looking ovary, and the other ovary has small cyst formations, circles, as you can see on this picture. Now, PCOS and PCOD, both of them are a little bit different. So what happens when a woman is affected with PCOS is nothing but her menstrual cycle is affected, her fertility is affected. So it is a serious condition as well because it leads to a lot of other comorbidities like diabetes or cardiac issues or obesity. So I'll elaborate a little bit over here. What is the difference between PCOS and PCOD? So polycystic ovarian syndrome is PCOS and polycystic ovarian disease is PCOD. So out of the two, PCOS is a more severe condition. It happens because of some PCOS happens because of some, I can say, endometrial diseases. Like, say, for example, there are some, your endometrial system, it releases it is responsible for releasing and regulating different hormones in your body. So when your endometrial system is affected in some way because of any reason, you can land up with PCOS. Because in this, normally in women, the level of estrogen, progesterone is, if it is normal, then we go through a normal menstrual cycle. But because of this endometrial system is affected, your ovaries will kind of release more male hormones, like the hormones like androgens or testosterone. So the level of male hormones in the body, in the female body increases, and hence the menstrual cycle or the fertility cycle is impacted, and it can give rise to PCOS. Now, why is PCOS so severe? Because it can lead to high blood pressure, diabetes, different heart conditions, and advanced endometrial cancer. So endometrial cancer is nothing but the cancer of the uterus. Now your uterus has a lining inside it, which is called the endometrium. So because of PCOS, this endometrium lining is affected, which so the chances of endometrial cancer in women having PCOS is twice as more as the normal women. Also, of course, it influences fertility in women, which is why it is difficult for a woman to conceive. I can't say it is not possible, but it is difficult. And moreover, there is even if you conceive, there is risk of premature birth, or there is a risk of miscarriage and some complications in your birth. Now, what happens in a PCOD? PCOD mein the ovary is only affected. Now, ovary mein cyst form hoga, and it is not so severe. Uh, uh, it is easily reversible with lifestyle modifications and changes in your diet and your exercise. So this is a normal difference between PCOS and PCOD. I hope everyone is with me and they can relate. If you have any questions, we can get to it. So far, so good. Okay. So now, once we've understood what is polycystic ovarian syndrome and what is polycystic ovarian disease, now what are the symptoms? Like कैसे पता चलेगा कि we have PCOS or PCOD, और अगर है तो उसमें क्या क्या होता है? So, for example, the most common symptoms are missed or irregular periods. Missed or irregular periods means when you have a missed period for more than 2 months, ranging from 2 to 6 months. So, more than 2 months से 6 months तक अगर आपको periods नहीं आ रहा है, means you can have PCOS. There is anxiety or depression. Yes, there is that social, you're always in that anxiety that, oh, my period cycle is affected. And this anxiety and depression, especially in women who want to conceive, because they're constantly stressed at the thought of, I have something wrong with my body and I won't be able to conceive. So this emotion, that PCOS has a lot of emotional impact also. So it can affect the mental health of a woman. Cyst formation, obviously there are cysts in the ovaries, so which lead to hormonal imbalance, which again impacts the menstrual cycle. Acne or oily skin. Oily skin hota hai, acne hota hai. If periods happens, so there is a question over here. If period happens early every month, then also is it an issue? So early, so here, I'll answer this question. The normal menstrual cycle is between 28 to 35 days. Having said that, अगर आपका period वो डेट से 2 दिन या 4 दिन पहले आता है या 4 दिन बाद आता है, that is absolutely normal. But again, if you're having irregularities in period, like if you have say heavy bleeding, or if your period lasts for more than 4 days, then also it is abnormal, then also it is PCOS. It can be considered as a PCOS. So yeah, and obviously we have fertility issues. Fertility issues in the sense trying to conceive, and there is a lot of difficulty with conceiving. Yes, so 28 to 35 day cycle is okay. Some women have 28-day cycle, some women have 35-day cycle. So you have to look out for आप कौन से range में हो. 35 days का cycle है तो भी 4 days आगे या 4 days पीछे, it is considered quite normal. Okay. Okay. Another less common symptoms like are pelvic pain. You may experience some amount of pain at the area of your waist or your hip. Okay. Some women have heavy bleeding. So generally, when we talk about PCOS, so the thought that comes to our mind is irregular periods nahi aata hai. Yes, ये एक aspect है. PCOS में आपको पीरियड नॉर्मल पीरियड भी हो सकता है, पीरियड्स आ सकता है, लेकिन जब भी आपको पीरियड्स आता है तभी आपको बहुत हैवी ब्लीडिंग होता है, विच इज वेरी अबनॉर्मल, और वो हैवी ब्लीडिंग काफी दिन तक चलता है, मोर देन 4 days. सो दैट इज ऑल्सो कंसिडर्ड एज अ सिम्टम ऑफ PCOS. आगे जाके PCOS is not treated. You have headaches, you have elevated blood pressure. Why you have elevated blood pressure? Because it affects some of the other organs in your body. PCOS is not restricted to your ovaries only. Your other organs are also impacted because of PCOS. Hair growth, hair growth where your hair shouldn't be. Uh, I can't say your scalp hair will grow, but the hair over your skin will grow. And there will be male pattern baldness, means baldness from around the circumference of your head. And decreased libido, your sexual drive also decreases. So these are the symptoms of PCOS. So if you have been diagnosed as having PCOS, you can face all of these issues or some of these issues. Now, once we okay, so there is a question again. How to deal with chin and face hair growth in such conditions? So first is chin and face hair growth. You address the symptoms, the underlying symptoms, why your chin and facial hair is growing. There are treatments for this. I'll get back to it a little later when we discuss the treatment options for PCOS. Once we've understood what is PCOS, what happens in PCOS, what are the symptoms in PCOS, there are a lot of myths surrounding PCOS. So I'll bust those myths today. The first myth is it only affects women who are overweight or obese. No, that is not the case. Women who is completely normal in her weight, normal weighing woman or an underweighing woman can also be diagnosed as having PCOS. Obesity is one part of PCOS. Yes, obese women are affected more, but it is a cycle. So ऐसा नहीं है कि obesity को obese people को ही PCOS affect करेगा. It can affect a normal weighing woman also. The second myth is you cannot conceive if you have PCOS or PCOD. This is also a myth. Many women give up thinking, oh, now I have PCOS, I won't be able to conceive. No, this is not the case. With treatment options and guidance from your care provider, you can conceive with PCOS. Obviously, you have to do some treatments and lifestyle modification. I can't say it is impossible, but it is a little bit difficult. But if you maintain your lifestyle, if you follow a strict regimen, if you follow a strict exercise regimen, diet, then you can conceive even naturally with PCOS or PCOD. In PCOS, there is no treatment. There are treatment options, but there is no definite treatment. Obviously, you need a combination of multitude of treatments. We'll get back to it later. Another myth is irregular menstrual cycle. Means PCOS. मतलब ऐसा नहीं है कि अगर आपका irregular menstrual cycle है तो आपको PCOS ही होएगा. This is another common myth कि PCOS है तो अभी menstrual cycle irregular ही होगा. या फिर इसका cycle एक XYZ person का cycle irregular है मतलब उसको PCOS है. PCOS is the most easily, it is used as a normal term. It is used in a layman language also. Arey, I have PCOS. No, understand. If I have an irregular menstrual cycle, doesn't mean I have PCOS. There are certain tests and there are certain treatment tests that you conduct to be diagnosed as PCOS. Okay. So going back to the next myth, birth control pill is the only option. Again, this is a myth. Birth control pill is one variant of one vertical of the treatment options that are available for PCOS. Okay. I'll address one question over here. Can I ask, I've been suffering from PCOD for the last 6 years and I've lost weight. Is there any specific reason? Okay. So coming to this, from the last 6 years, if you there is no definite treatment for PCOS. So once you're diagnosed as having PCOS, you have to follow a regimen. Like say, for example, if I've been diagnosed as having PCOS, I follow strict diet, I follow exercise regimen, I follow other medications. then my period is normal, then it is normal for some years. After some years, it hit backs again. Okay. So with once you're diagnosed with PCOS, for lifetime, you have to follow certain regimens, because the moment it is a cycle, the moment you lose that um, lifestyle, the moment you go back to eating junk or due to any reason, PCOS hit backs. In some cases, if the PCOS is genetic, then you have to lifelong you'll have to follow some regimen. So sometimes you may be diagnosed as PCOS in your reproductive age, but it doesn't hit you for a very long time. So the answer is here is very variable. It's like there is no definite medication कि एक बार ले लिया फिर lifetime के लिए cure है. Lifetime के लिए you have to keep taking care of yourself. Okay. Another question, I get periods regularly, but bleeding is not happening. Sometimes blood becomes brown after some time. What could be the reason? Okay, so again, one of the reason may be, so you have to talk to your care provider about diagnostic options. If you have PCOS, then this may be one of the case. If you're getting periods regularly, but the bleeding is not adequate, it is you're not bleeding normally as if you bleed in normal menstrual cycles. So again, you have to talk with your gynecologist or your care provider. Okay. So now moving on to okay. So moving on to the treatment options. So I hope I've busted the myths surrounding PCOS. So if you have any questions, we'll get back to that at the end of the session. What are the treatment options for PCOS? First is PCOS के जो symptoms होते हैं, उसका treatment होता है. So for example, if I have irregular periods, I'll get medication for irregular periods. So I'll be put on, say, birth control pills or other pills, menstrual pills. Then if I have, I have hair growth, then I have options for that. If I have some other comorbidities like, say, high blood pressure along with PCOS, then I'll be treated for high blood pressure. So whatever symptoms I have in PCOS, the treatment is of those symptoms. Or the doctor may, if I consult a doctor, the doctor will ask my medical history, whether I have any other underlying comorbidities that are impacting on my menstrual cycle, and the treatment will be done accordingly. So treatment can be done with medications, lifestyle modification, and diet. And it can be a combination of any of the three options. Like you can follow for women who have mild PCOD, which doesn't impact so much on your other systems, only lifestyle modification and diet is okay. But if a woman has advanced PCOS, in which she's facing a lot of difficulty to lose weight, a lot of difficulty to maintain her menstrual cycle, then she may need medications. So in that case, she'll have to go with all the treatment options, medications, exercise, and diet. So depending upon the severity of your PCOD or PCOS, you can follow all these treatments. Okay. So coming back to the first treatment option, that is weight loss and PCOS. As I told earlier, that obese women or overweight women are affected more than normal weighing women. So in this case, weight loss becomes important. So also, this is also a fact that when you plan to lose weight during PCOD, initially when you're losing weight, you get a lot of resistance to lose weight. So losing weight is not easy, but it is not impossible. But once you start losing weight, even if there is weight loss of just 5%, you can see significant improvement in your condition. Okay. Now, how do you lose weight? So first is regular exercises. Exercises are a must. According to researchers and studies, it is proved that when you exercise minimum 3 times in a week for an hour, there is a significant improvement in your body. Okay? So how can regular exercises help? Especially they help in maintaining blood sugar levels and by improving your insulin sensitivity. Now, why is it important during PCOS? Because in PCOS, studies have shown that there is a correlation between PCOS and your blood sugar levels. So, now, in a normal body, your cells use up insulin to for energy. Insulin for different doing different works for releasing energy. Like for it, you use up a lot of insulin. But when you have, say, PCOS or when you are diabetic along with PCOS, your insulin resistance increases. Means the cells are not using that much amount of insulin, and that insulin it circulates in the blood. So what happens is the resistance to insulin increases. And once that increases, your ovaries or your endocrine system starts to release more of male hormones rather than the female hormones. So with exercise, you can keep that insulin under check, okay? Because the blood sugar levels are constantly in check with exercise. This is one way to lose weight and also improve your sugar levels. Exercises can also reduce stress and improve your mood. Okay, now there are researches and studies have now shown a direct correlation between stress and PCOS, stress and diabetes, stress and other disorders. So once your stress is in check, once your mood is improved, it helps to improve your symptoms of PCOS. Also, exercises reduces the risk of cardiovascular diseases. There is a direct correlation of PCOS with some heart problems. Researchers have shown that women who have PCOS are at a risk of certain cardiovascular diseases. So with exercises, these diseases are kept in check. Also, it helps to conceive. So once you lose weight, there is a significant improvement in your bodily functions. So your hormonal levels also come at regular normal levels. So that helps you to conceive. So especially women who are trying to conceive, you have to lose weight or you have to at least do regular exercise. Okay. You can opt for yoga also. Yoga is another great method for keeping your PCOS in check. These are some of the asanas that you can do. Either you can do yoga flow, in which you do certain asanas in a continuous flow, or you can stay in one asana for a few minutes. Okay. So yoga also helps to improve your regulate your blood sugar levels. Now there are certain asanas that directly have an impact on your reproductive system. So once you assume that pose or once you assume that asana for say 3 times in a week or say 5 times in a week, then there is a significant improvement in that organ ka function. So you can do yoga also, you can practice for PCOS. Another method of losing weight is strength training. Now here I have to shed some light on strength training. How many of you think that वजन बढ़ाने से weight भी बढ़ता है? Can I have a few like someone who thinks कि वजन उठाया तो weight बढ़ता है, you get your body becomes like men and ऐसे होता है. But this is not the case. Okay. I hope I'm not boring you. I hope the lecture is informative and you guys are with me. Okay. So this is a myth. वजन उठाने से weight बढ़ता है. नहीं, ऐसा नहीं है. When you do strength training, okay, when you are lifting weights, you are putting your body in that mode of your fat loss becomes much more evitable. Matlab, it is visible also. When you increase weight, your fat loss becomes faster. Okay. And your muscle tone also improves. So strength training is one of the best ways to lose weight, better than yoga, I would say, in some cases. So yes, you can go opt for strength training also. A brisk walking. So walking has been shown to significantly improve your sugar levels. Walking has a direct impact on your sugar levels. Okay. But having said that, you have to walk for minimum 1 hour. So 1 hour straight, you have to walk. If you walk for half an hour, if you walk for 45 minutes, if you walk for 15 minutes, if you walk for 20 minutes, that is not going to work. You have to walk for 1 hour at least. Okay. Now, coming back to yes. Another great exercise is swimming. So for people who find that other options are not working out, they don't have that access to go for walks, or they do not have, they're not comfortable with strength training. And they find yoga very boring. So you have swimming. You can, especially if you're comfortable with water, swimming is the best exercise wherein, especially when you start exercising, when you're overweight or obese, swimming is the best exercise. It is the best form of resistance exercise that is not too much on your body. So the buoyancy of the water, and you are also adding weight to the body. At the same time, you can easily do those exercises. So one can consider swimming as a very good option for losing weight. And we have something called as aqua aerobics also, which is coming up, and which is a good form of aerobic exercises. So swimming again has shown to improve your strength, not only your strength, but it also tones your muscles, and it also improves your cardiovascular endurance. So you can consider swimming as a form of exercise. Next, we come to another option for keeping your PCOS, PCOD in check, that is diet. You have to follow a well-balanced diet. So you can consult a nutritionist or a dietitian, and you can work out, and they will prepare a chart for you wherein you can have, you know what to eat, how much to eat, and how can you keep your sugar levels in check. Now, in diet also, I would address this myth. Eating less means you're losing weight. No, this is not the case. You have to eat well to lose well. Okay. So when you eat less, so you think you're not eating anything and you lose weight? No. So again, if you're starving your body, again, you're disrupting your sugar levels. So when you're starving your body for a very long time, your sugar levels, there is an imbalance in your sugar levels. Again, you'll, so people, especially with diabetes, so if they're starving for a very long time, they're again having a negative impact on your sugar levels, and the symptoms of your diabetes can also worsen. So my advice here is to consult a dietitian. You should know what you're eating and how much you're eating. I'm talking about mindful eating over here, and also rightful eating. So you know how much to eat at regular intervals, so that, and what to eat, so that you are helping your body to overcome the problem of PCOS. Now, what should people with PCOS or PCOD include in their diet? Green leafy vegetables, legumes and pulses, nuts and seeds and fruits. And sometimes eating, see, you know what to eat. Most of the people you ask, people with diabetes for that matter, they'll tell you, oh, I know I shouldn't touch this. I know what to eat. But sometimes what not to eat, knowing that also matters more than you know what to eat. So what not to eat for a woman with PCOS is processed foods like sugars, processed sugars, like, or breads, white bread, maida, sugars. Okay, especially foods that have high sugar level in them, level of sugar. Also, not to eat packaged food. Okay, and not to eat fried food. So these three things, if even if you have, if you can control these things, then I think half your battle is won over there. Because in this lifestyle wherein we are working professionals and or corporates, the access to packaged food is so much easier than homemade or at least home cooked food. So here I would request everyone to, or anyone who has PCOS, to stay away from packaged food, sugary foods, and maida. So if you're controlling these three things, you'll see your body respond and react in a very positive way. So yeah, so here I end my talk on PCOS and PCOD. So yeah, so I'm open to addressing all the questions now. So yeah, okay. So there is one question. I got periods regularly, but okay, I addressed that. I was told that I have PCOS, PCOD. How can I confirm which one I have? So you need to talk to your care provider, or at least whoever has told you who you have PCOS or PCOD. So generally for this, there are ultrasound tests done, your blood sugar levels, your lipid profiles done, so that if you have PCOS and if there is any adjoining comorbidity, like changes in your blood sugar levels, or if you're diabetic, then there are chances that you have PCOS. But if you don't have any comorbidities, and if you're just on ultrasound, if you have cysts in your ovaries, then you may have PCOD. So whether you have PCOS or PCOD, depending upon your medical history or other symptoms and your other tests, only your care provider, your general physician, or your doctor will be able to tell you if you have PCOS or PCOD. So you can confirm with blood tests, lipid profiles, and hormonal tests that are done, and ultrasound tests. So there are these three options from which you can confirm if you have PCOS or PCOD. Okay. So then there is another, can you help me with the questions over here? I can't see more than 2-3 questions.
Yes, sure. Okay, Dr. Ankita, you can, stop your screen sharing.
Yeah, okay, I just do
Okay.
that.
1 second.
Okay.
Perfect. Okay. How should a night shift employee diet should be? Timings.
So a night shift employee can also diet after taking a thorough assessment of your lifestyle and your like what food you eat, how to eat, what to eat during the night. So you can consult a nutritionist. They guide you better. आज के जमाने में ऐसा नहीं है कि आपको बोल देते हैं कि आपको यही डाइट फॉलो करना है. If you have any like for example, say you are in night shift, so your diet will be given accordingly. If you are an employee who cannot say for example diet, you cannot stay hungry for a long time, so your diet will be given accordingly. So my advisor is you consult a nutritionist. She will guide you properly as to how to eat and what to eat when you are in your night shift. I hope I've answered that question.
Okay, so we have next question. How do we know if it is PCOS or PCOD that one has?
So yeah, as I told earlier, so there are tests. So you have to, if you have PCOS, or how would you first of all know if you have PCOS or PCOD? So first, if you have missed your periods for more than 2 months or 3 months, you have to consult your gynecologist or your general physician. So the physician or your doctor will give you certain tests, blood tests, your lipid profiles, your ultrasound tests. Depending upon all these tests, your diagnosis will be made whether you have PCOS or a PCOD. So there are certain tests that you do to diagnose if you have PCOS or PCOD. Yeah. Next question.
If period doesn't happen more than 2 months, what action to take?
So if period doesn't happen for more than 2 months, you consult your doctor. Okay. Again, the doctor will ask your medical history, your other history, what problems you have. He will guide you accordingly. He will ask you to do certain, he or she will may ask you to do certain tests. And accordingly, you have to see for other symptoms. Like if you're not getting periods, you're gaining weight, you're gaining abnormally large amount of weight in a very short period of time, then you can probably go to a care provider and start working on your exercise and your diet regimen. Next question.
My period is stopped last 1 month, 18 days, and sometimes white water releasing, and my whole under thigh part is paining.
Okay, so you have to consult your care provider. If if your period is not coming for 1 month or 18 days, so I would like to ask whether your periods were normal up till this time. ये यही time हुआ है कि you get irregular periods very often. If you're getting irregular periods very often, then again you need to consult your care provider. He may put you on some medication and try to bring your cycles back to normal, and he can suggest you other treatment options as well. Next question. And
Please,
sorry about the question earlier. If you have a white discharge or you have thigh pain, there can be some adjoining problem or some other infection. So my request here would be to consult a care provider or a doctor. Yeah. Next question.
please suggest during periods what one should eat as one feels so low in energy.
Okay. So what you should eat and drink, you should drink loads of water. Eating, you have to follow a well-balanced diet. As I told you, you cannot starve yourself. I would suggest eating healthy foods every 2 hours at short intervals. So if you're, say, feeling low, you can consume some nuts. You can consume fruits. Fruits are a great way of, keeping they have fiber in them, so they kind of keep your gastrointestinal tract and other organs in checks. That again impacts on your period pain, or that when you're feeling low or when you're feeling driven, when your mood is not so good. One other thing that you can have is dark chocolate. Dark chocolate works wonders especially when your mood is low. It is not that great on sugar. So the sugar levels are low in dark chocolate, and it has cocoa, which has endorphins. Once you eat, it directly impacts on your happy hormones. So you can eat dark chocolate. You can also drink lots of water and stay hydrated, and do a little bit of exercise to keep your levels in check, the mood levels in check. Next question.
What are those tests so that we can get to know we have PCOD?
So test may first of all ultrasound test. So ultrasound generally the doctor does. So ultrasound में पता चलता है कि आपको PCOD है कि नहीं. अगर अल्ट्रासाउंड पे आपके ओवरीज जैसे कि मैंने बोला नॉर्मल दिखते हैं, that means you don't have PCOD. If on ultrasound there are multiple cysts in your ovary, that means you have PCOD or PCOS. So अगर आपको कोई adjoining symptoms भी है, blood test है उसके लिए. जैसे ब्लड टेस्ट में या यूरिन टेस्ट होते हैं या लिपिड प्रोफाइल होते हैं, जिसमें और कुछ टेस्ट होते हैं जिसमें हार्मोनल लेवल्स भी मार्क होते हैं. जैसे कि आपको अगर आपके पीरियड्स नहीं आ रहे हैं रेगुलर, तो आपको डॉक्टर ने कुछ पिल्स दिए हैं आपको पीरियड रेगुलर करने के लिए. फिर ड्यूरिंग द सेकेंड और द थर्ड डे ऑफ योर पीरियड्स देयर आर सर्टेन टेस्ट दैट यू डू, जिससे डॉक्टर को पता चलता है व्हाट इज द स्टेटस ऑफ योर हार्मोन्स. तो उससे भी देयर इज अ जजमेंट मेड वेदर यू हैव PCOS or PCOD, and accordingly the treatment is done. Next question.
I'm not getting periods naturally if I take medicine only getting my period.
So if you're not getting your periods naturally, that means you may have PCOS or PCOD. So for that, just relying on medication is not going to be essential. You need to work on your diet and exercise, and look out for any other problems like thyroid or diabetes or any other comorbidities. Especially if you have hypothyroid, your weight loss becomes difficult, and getting that again, if your weight loss becomes difficult, again it has an impact on your period cycle. So again that becomes difficult. So अगर आपको ऐसा लग रहा है कि हर बार आपको मेडिसिन खा के ही आ रहा है, you may have to change your medicine, and you have to focus more on your diet and your exercise. You cannot lead a very sedentary life, and so if you are sedentary, also you look into that. And if you're sedentary, start working out, start eating healthy food, and preferably change your medication. If you're getting just with medication, then I think you need to work more on your diet and exercise, because sometimes if the symptoms are severe, only medication will not work. Next question.
Having painkillers on every period may lead to any serious consequences in the future.
No, it doesn't lead to any serious consequences. Painkillers, especially to calm down the to bring down the period pain, that is okay. But if you're taking painkillers if your pain is unbearable that you have to take painkillers, you can also use alternate methods like hot packs, some light amount of yoga and breathing exercises, and drinking lots of water to take care of your period pain. But no, you have to check with the tablet that you're taking, whether you're allergic to any ingredient in that tablet, or you have to look out for the side effects that the tablet has. But in the long run, most of the tablets that are prescribed or what people take, they don't have any adverse effect, not proven to have. Next question.
Is bleeding of only 2 days in your periods normal?
No, you have to have a bleeding of 4 days. Okay, if you're getting bleeding only for 2 days and you're not getting for the rest of the 2 days, that means there is some hormonal imbalance or some problem. So you need to work on that. Next question.
Is there a blast therapy to get rid of the cyst instead of a surgery?
No, pardon me.
Is there a blast therapy to get rid of the cyst instead of a surgery?
So surgery is generally not done if you have cyst. If you have cysts in your ovaries, that is generally taken care of with medications. But having said that, there are some cases in which you have to undergo a surgery, especially if the cyst has been, there are some cysts that have that increase in size that are there. They don't dissolve with medication. And especially for women who are trying to conceive, when you're planning to conceive, these cysts can give problems. So if you're not planning, if you're not able to conceive because of it, then the doctor may advise a surgery, in which case the surgery becomes essential, and it is better to undergo a surgery for the cyst. So in some cases, once the cyst is removed, you will see that when you're trying to conceive, it becomes much more easier. So in some cases, yes, surgery is advisable. Next question.
I have chocolate cyst since 2 years and we are trying unable to conceive.
Okay. So first of all, you have to see the location of the cyst, which the doctor will come to know on ultrasound. So if the cyst is at such a place in your reproductive system that comes in way of conceiving, then you have to remove the cyst. There are some cysts that are there. They are उससे कुछ मतलब आपको कुछ symptoms नहीं हो रहे हैं. They are there. They are not increasing in size. They're just there. फिर भी आप conceive कर रहे हो, तो ऐसे cyst को generally doctors don't think much upon it. But if you have any such cyst which is coming in way of your pregnancy, you can consider surgery as an option. Next question.
I have regular periods. Recently, I got abdominal pain after an ultrasound. I understood I have a cyst of 5.5 centimeter in the right ovary. Now, blood flow has also reduced and has started to gain weight every day. It's depressing. Now, the doctor gave both pills, both control pills.
Okay. So, birth control pills are an effective medication when you want to take care of your cyst. If you have abdominal pain, or if there is any other pain that going along with it, you should let your care provider know that something of this sort is troubling you. So sometimes the cysts are medically dissolved with medication, and if they're not, if they're hampering your daily activity in any way, then you need do share this with your care provider. He may consider surgery as an option, or he may give you medications. He may change the medication, or he may change the dose of the medication. Next question.
I have painful periods. They are regular but have heavy bleeding and becomes difficult to do daily chores. On first day, also I gain around 5 kg during periods.
Okay. Heavy bleeding again is not normal. So when you have heavy bleeding, you have either PCOD or you have some other condition. So talk to your care provider. If you have PCOD, then take your medications accordingly to bring down the amount of bleeding. Some women gain weight of say 2 to 5 kgs during periods because there is a lot of bloating and water retention. So, and that goes away generally once your periods ends. But if still that bloating is not going, then you need to check if you have PCOD or no. If you're gaining weight, then you need to work on your diet and exercise. So yeah.
I think we have no more questions. So I think we can end the webinar.
Okay, I think I hope I've answered all the questions. People, I hope you guys are satisfied with whatever answers you received.
I'm sure they are. Okay, thank you so much, Dr. Ankita. Thank you so much for coming. Thank you so much for this wonderful session. We it was really informative. We really enjoyed it.
Thank you so much for inviting me. And it's my pleasure because I'm very passionate about women's wellness and women's health. So yeah, in any way, if I can help, that is my honor. Thank you so much for inviting me to this platform.
Thank you so much, Dr. Ankita. Thank you so much. Take care. Bye-bye.
Yeah, bye-bye.